In my presentation, I presented the way the EORTC infrastructure is moving. And by infrastructure, I mean the work of the EORTC headquarters, whatever we build and organize to support the research of our investigators, of our network of investigators. So what we are doing there, we see how the research environment is changing globally and how our structure needs to adapt to support all the questions that are coming in this new research environment, because we know and we recognize that no matter how good our investigators are, they need the support from our side to deliver what they want to. So it's quite diverse. So we use the term in a very broad sense. So it is what people indeed recognize as infrastructure, like software or communication platforms or stuff like that, but it's also things like a network of contracts, a network of partners with specific terms of engagement, specific language that we use in our documents, our protocols and patient information sheets. So a whole ecosystem of things that are reusable, that have to be in place at every type of research we do. So we try to organize that in a way that anybody can readily use without spending time reinventing the wheel. We've seen a structuring effect. So people are starting to work differently, because when there is an infrastructure in the center, that infrastructure is addressing a need and not a specific specialty, for example, or a specific geographical area. So people have to reorganize themselves to come around the clinical needs. So that we have seen, and we're very happy about it. We have seen many changes and successes on the technical front. So our quality has improved, our consistency in delivery has improved, the waste has decreased. Even if these changes were initiated to respond to a changing environment, that environment never stops changing. So we need to keep changing what we are built along the way and adapting to what we see coming, both in terms of science and in terms of regulatory and technical improvements. The second challenge we face is to scale the initiative. We're currently focusing in Europe, because that's our natural operating environment. But we built it in a way that it can scale globally, as EORTC traditionally has been doing global research. So we have talked a lot with other partners in the United States, for example, or Canada. I try not to predict the future, so what would I try to do with these initiatives? I would like the initiative to always fit the environment, to be able to answer the relevant questions at any one time. What we try to do more, rather than predict the future, is to be very deliberate in the way we do our changes, the way we develop our infrastructure and our research, so we can naturally follow the changes that will always be there, and we will have to live with. I'm very happy with this conference, I must say. It has been, I have been following a few EGAMs throughout the years, both as an EORTC staff member, as an investigator before, and it has been the most impressive meeting I remember, so I'm really happy about it.